I actually started at Active Health in February of 2000. So I started here as an associate, and then I moved up into managing physician. So I got to kind of help manage the staff, and I worked with insurance companies, I worked in the computers, and then in 2015 I actually purchased the practice. So I've been here for a little over 25 years, and then I've been the owner for a little over 10 years. I actually told my second grade teacher I wanted to be a chiropractor. And I grew up near where they invented chiropractic. It doesn't have a great reputation where I grew up, but we actually had a chiropractor that came to our house when my dad hurt his back on the farm and worked on him for a few days. And I thought it was pretty cool. I love the ability to help people change like normal everyday life. Like most people I feel like have these dreams that they want to work with like the top athletes, or they are going to invent something that changes the world. And I just want like the everyday Jack and Jill to know how to do something better, to sleep a little bit better, to sit up a little bit longer, to keep moving longer in life. Like, I love the little wins. They're my specialty. That's what I like. I would say in the past 25 years, I know that this practice has seen over 15,000 new patients. Most of those, because we've always had, even when I've had other doctors here, if I was the associate, we've always had a type of practice where we all share the patients. So I've at least had my hand in all of those numbers. One of my friends does office chiropractic coaching. And when I first took over the practice, he said, I can't believe how well you've done. Usually when you buy a practice, there's a huge dip and you kind of have to rebuild. But I was here for so long before that I accidentally set myself up for success. My patients honestly mean everything. I don't have a purpose without people. One of my biggest frustrations is like family members. I know they're hurting and they won't let me help them. People at least come here and they ask me to help them. Like that's why they come here. And if they say, I've had this pain and I don't know what to do about it, and I think I can help, they can feel better within the next hour. I love coming in and say, I've actually seen this before and I know I can help you. Recently, I got to work with this patient. She came in with dark sunglasses on, super quiet face. She confided in me once I got into exam with her that she had had a headache for over 17 days straight. She had tried everything from water, Excedrin migraine, to the serious migraine medications. She had done a lot of different things. And we talked for a little bit in exam. She said, I saw somewhere online, I think chiropractic can help. And I said, we definitely can. Depending on what kind of headache, let's try to figure out what kind of headache you have and what's going on. And she came back in for her next follow-up 2 days later and she hasn't had a headache since. She came in with a bright, shiny face, no dark sunglasses anymore. She could handle the sunlight. It was awesome. It was really cool. We talked about bringing in the neuropathy. A few years ago, I would have been, at the time, only late 40s, and I was diagnosed with neuropathy. That's why we brought it into the practice. So I started looking into it, and a chiropractor friend of mine from college actually was already practicing with a natural way to fight back against neuropathy, which no one said was even an issue. Before we brought it into the practice, I did the whole program myself to make sure that I wanted to see what it did. I mean, I already knew what chiropractic was. I've been doing that since I was a teenager. So I went through the neuropathy, and I haven't had symptoms now for over 2 years. It's a combination that we do of home therapies and in-office therapies and nutrition, but it's all natural and it actually heals the nerves. My entire philosophy with every single patient is to first make you feel better, because that's why you come here, and secondly, teach you things to do to stay feeling better.